Governor Gavin Newsom has declared a state of emergency in California for monkeypox to bolster the state's vaccination efforts. So this declaration allows the California Department of Public Health and other administration officials to coordinate what they could call a whole of government response to the monkeypox virus, seeking additional vaccines and leading outreach and education efforts. California is the second state in the last 3 days to take this step. And to discuss a bit more, Dr. Ernst von Schwartz joining us this morning. Good morning, Dr. von Schwartz. Good to see you again. So a state of emergency in California for monkeypox, 786 cases here in the state. What does this mean and what happens next?
Well, what it means basically is the state tries to get more resources for the vaccine for either pre-exposition prophylaxis or post-exposure prophylaxis. That means people at higher risk of monkeypox, which is mainly right now the population of men having sex with men, are considered higher risk and might seek vaccination. And the others are those who have been exposed to people with proven monkeypox. And even though they have been exposed, the vaccines might still work if given early enough. Keep in mind, for the currently vaccine which is available, the Jynneos, it requires 2 doses 4 weeks apart, and it takes 2 weeks to get full vaccination. But this is what the state wants to do. They want to have enough doses to vaccinate those who have been exposed in particular.
How dangerous is monkeypox? We've been dealing with COVID for the last couple of years. We know how dangerous that is. What about this one?
Not as bad as COVID, because, I mean, if you look at the history, originally originated from Congo, from Middle Africa. There were 2 strains. The first one showed approximately 10% mortality rates. The newer ones from West African countries, which is the same which we see in the United States and Europe right now, has a fatality rate of approximately 1%. So far in the US, nobody has died, but we see in more and more cases, as you have mentioned, including recently 2 children who were also exposed to someone with monkeypox.
Contacts or sharing sheets or clothing can spread it as well. Dr. von Schwartz, thanks so much for joining us.
Thanks for having me on.